Hello and welcome to the part two of my recap of the Power Lymphatics Conference 2026. You can see I'm in my hotel room. I'm getting ready to leave. So this is the final part of the conference. What I wrote in my notes and what I think would be valuable as clinical pearls to share with my colleagues. So this video is for my colleagues. If you have questions about anything that I'm talking about and you are a patient of a CLT, definitely ask the CLT for their input on your particular case. This is not any way, shape, or form medical advice. So what we heard from the researchers was lymphedema. First, I'll cover some things about lymphedema. 80% of lymphedema patients in one center of excellence were found to have fat hyperplasia. So we can't think of lymphedema as just like a fluid disease where the fluid's in the wrong place. There's also a fat component. And I can quote and say that the researcher said that the lymphedema fat is haywire. So this is not just putting on fat just the same as your body. It puts fat on other parts of the body. This fat is actually different from your so-called normal fat. And it may be hormone related because they saw when they were doing the liposuction surgeries for people with the lymphedema that the distribution of the fat is different in men and women. And not just like more fat in one place, but different types of fat in different parts of the body according to how much estrogen that body has. So this is it's so interesting. More research is always needed, but it's interesting to hear these tidbits from the researchers. Okay, so now let's talk a little bit about lipedema. So lipedema, the fat disorder. Lipedema symptoms, if someone it has lipedema, and maybe especially if they have also POTS, and if you put them in compression as a lymphedema therapist, and if they find their symptoms are getting worse, then you should be thinking, is this disease have a vein component, a venous component? And we know lipedema does have in many patients a venous component. So send them to the vein surgeon for imaging. They may have something like May-Turner's disease. So definitely have them to have the expert look at the veins. What we heard over and over again from several different speakers was the impact of GLP-1 receptor agonists, GIPs, these medications on lipedema. So one clinical pearl was as the GLP-1 receptor agonist is reducing the so-called normal fat on the patient's legs as they're taking it, if they have lipedema, their lipedema nodules may be more prominent as the rest of the fat is decreasing. The lipedema nodules may become more prominent. They may temporarily be more painful. So it's good to talk to the person with lipedema about this and say this is not that the medicine is not working. It's that the medicine is working and we're kind of seeing the lipedema fat more because the regular fat is reducing. But we heard from speaker after speaker that usually people can tell within a week or two. The inflammation goes down before the weight ever changes when people are taking the GLP-1 receptor agonist. And so the pain can possibly reduce for people with lipedema if that pain was due to this inflammation that the GLP-1 GIP, maybe even the triple G medications are reducing that inflammation. But we have to understand that they may need to have a microdose of their GLP-1 medication for the rest of their life because this is a genetic disease. They didn't ask for their disease. They didn't get their disease through lifestyle. So just changing lifestyle isn't going to erase the disease. So understand that this may be an ongoing medication for the chronic disease of lipedema. Lipedema can have lymphedema at any stage. So old times in the before times, in years ago, you used to see the staging, and then there was this thing where stage 4 was the more advanced stages were both lipedema and lymphedema, but now we're seeing you can have this lymphatic dysfunction at any stage of the lipedema, so you don't have it only in the very advanced stages. And also from the vein side, we're always looking at how do we get the garments covered for people with lipedema. To understand from the venous side, there's research and practice that says that in the SEEP classification, the SEEP classification of 3, so if you're a SEEP 3, that is lymphatic dysfunction, that is swelling with the venous disease. So that could possibly be classified as lymphedema so that someone would have that diagnosis so they can get the treatments and the garments. But that would be like we're massage therapists, we're lymphedema therapists, we're not the vein surgeons, so that would be up to them. But that would be an idea for them to get imaged and really looked at by a vein expert. All right, so let's go into more clinical pearls that I picked up in the different presentations. For male urination, when someone is in their decongestive therapy bandaging, the idea was you can use a motor oil funnel because that will have a longer thin part of the device, and that may help with males urinating and kind of making it clean so they're not soiling their bandages. And for women, the Shiwi, which I have in my office, and then I was able to like raise my hand in the presentation and say, and this is not just the Shiwi is a brand, so it's like a female urinal funnel, but the female urinal funnel is both in silicone that is washable and reusable, but you can also find them online, multiple of them, like 20 or 50 of them packet. That are a light cardboard, a really thin cardboard. So these can be taken and they come flat, and like keep a few in your purse, and then open them up, use them, and then you don't have to like rinse them in the bathroom and put them back in your purse. If you're out and about, you can just throw them away and have that temporary urine funnel and not the need to clean it and reuse it. So everyone was excited to hear that. So I was glad that I could help. So this is what I'm going to share is for lymphedema therapists only, and this should be done only under the direct specific advice of your personal lymphedema therapist. Do not go and try this at home because you heard it on a video on the internet. I don't know your particular type of lymphedema and what your body needs. Your lymphedema therapist knows. But what we learned in this conference was that some lymphedema therapists are experimenting with having the patients at night put on their night garment, and then they put on their compression pump, and then they let their compression pump work, and it's a gradient compression pump, the professional ones that you get with a prescription, not something you buy off of Amazon. So we understand that this device is actually providing proper gradient compression. Set it to 45 millimeters of mercury and let it inflate to where it's all the way up, inflated to the groin, and then the client can sleep with that versus having to put some kind of external compression garment over it or do bandages over it. So the idea is that the lymphedema therapist, in specific circumstances, that it's your lymphedema therapist recommending that you do this to yourself, not me, not the internet, is that it's an option to use the lymphedema pump as the compression garment during sleep. If there's any kind of difficulty or it's painful, all they have to do is unzip it, so it's actually easier to get out of if there's a problem than a 45 millimeters of mercury garment to try to get off in the middle of the night. So this would be one option. So if you are a lymphedema therapist, think about this, which clients may be this might be the answer to getting them that night compression if they find it hard to put on. So we'll move into after total knees. There was some advice after total knees. some person in the audience suggested, I think it was a person in the audience that said, or the speaker that said, try having the patient use edema wear in the weeks, the time before their total knee, and to get that knee, that leg decongested a little bit and make the surgeon a little bit happier about the situation. So edema wear could possibly be used before the total knee. And then if they're coming to you in your office as the lymphedema therapist after their total knee and they have a lot of firm tissue, a lot of hard tissue, instead of like trying to work it and soften it after the visit has begun, maybe have them come a little early and then start them on the pump, if you have a pump in your office, on very low pressure to kind of get that process started. And then you go in and do your whatever you're going to do for them after their total knee. So that let the pump help them start softening that thick tissue before their appointment begins. Understand that if someone's on an anticoagulant, and this is for total knees and also for anybody that's on an anticoagulant, combining edema wear while someone's on an anticoagulant, we have to be more cognizant of whether there's petechia. We have to make sure and very much look at whether the edema wear is causing petechia in that client. And then we had a really great presentation. This was, for me, the most valuable presentation in the entire conference. It was how you decongest like a larger patient with a lot of comorbidities. And the concept was, if you're decongesting a large patient, if they're going through the CDT, two things. Number one, lymphedema is never an emergency unless there's an infection. So make sure that they have you have your ducks in a row, they have their ducks in a row, and we're not rushing into this like it's an emergency and doing too much and doing more than the client wants to do, working harder than the client, and trying to decongest the client that has not cleared their schedule and fully understands, is fully committed to the process of CDT. So number one, lymphedema is not an emergency unless there's an infection. And then if it is an infection, they need to go to the emergency room for that. But take the time and let's do it properly. And that's the first concept. And then the next concept is, before you start doing it, always answer the question, and then what? What is going to happen after they're fully decongested? Do they have the ability and the finances to be in garments? What are they going to do once you decongest that limb? Because the only thing worse than like doing like a sloppy job and not decongesting them properly is decongesting them properly and then they're not going to be able to, or they're unwilling to wear the garments after you did all that hard work, and then they refuse to wear compression on the area that you just decongested. So definitely it has to be, a lot of like looking at the patient, the client, like understanding the client and coming to that agreement with the client before you put all that hard work into decongesting them, if they're just going to get decongested and then not be able to keep up with those results. So the idea is, what is ongoing care look like and why are we decongesting? What is your goal? And again, like I hear at a lot of conferences, like you need to manage expectations. Like you're not going to have beautiful legs just like the models in the ads in online and other people in the world. You're going to have your limb, but it's going to be more useful. It's going to have improved cosmesis, but you can't imagine that just decongestion is going to give you legs like a supermodel. So managing those expectations, and then also understanding what their expectations are, what they're willing to do after the decongestion, because whether it's the surgery and lymphedema or lipedema, the surgery or conservative care or decongestive care, at the end of that process, they still have the disease. They still have lipedema, they still have lymphedema, they still will have to do ongoing care. None of this is a cure for either of these conditions. All right, so that is my wrap up. I made 2 videos for this conference. This is one of my favorite conferences that I go to. It's in LA next year. I'm sorry, it's in Las Vegas next year. In April, we're going to be at Caesar's Palace. One tip, if you are a lymphedema therapist that's looking to attend this conference, is maybe you can see it behind me, but they do not give coffee makers in the rooms in Las Vegas in any of the hotels that I've been at on the strip. So I actually bought online a 1 cup coffee maker and I pack it in my luggage so I can have hot water here in the morning, because that is one thing you will not see. You will not see a clock in this room, and you will not see a coffee maker anywhere. They want you to go down there. They want you to gamble. They want you to lose track of time. And this is my pro tip if you are going to attend Power Lymphatics next year. And I hope to see you there. This is my favorite conference of the year. I look forward to coming to this conference every year, and I hope to see you here next year. All right. Thank you, and have a great day.